Thank you, Rahil, and thank you, everyone. I'll be presenting the findings from a pre-post study on evaluation of nutrition-sensitive competencies of the agriculture and water technology graduating students in Ethiopia. Next slide, please. So my presentation will contain some background about the study, the rationale and research objectives, and some description on interventions between the two studies and the methodology. And there are two findings from the study, findings for the nutrition sensitive agriculture as well as for WASH competency assessment. And we'll have also some program implications, conclusions as a result of the results, and we have some recommendations. Slide, please. Next. So as you know, this malnutrition is a significant problem in our country. As you know, from the recent mini DHS in 2019, about 37% of children are still stunted, 7% are still wasted, and 21% are still underweight. This shows we need to work hard on reducing malnutrition through multi-sectoral coordination. So as you know, the malnutrition can occur due to the inadequate food intake due to the household food insecurity and improper consumption, as well as diseases related to water sanitation and hygiene service and practices. So the agriculture and the water sector have different responsibilities in addressing this issue. And even though the agriculture sector has huge potential to impact the nutritional status of the population, nutrition was not its prime agenda, and this affected the sector's ability to impact the nutrition situation in the country. Next slide, next, please. So this nutrition sensitive agriculture concept had been just in its infancy in Ethiopian agriculture sector, especially in making the production and consumption equitable for communities. Next, please. WHO also estimated that 50% of the malnutrition is associated with the repeated diarrhea or intestinal wound infections as a result of the inadequate wash, and diarrhea is the second leading cause for under 5 days, and 80% of the diseases related to this diarrhea due to poor wash environment. So the country developed the National Nutrition Program to address the issue and gave roles to different sector government ministries, including the Ministry of Agriculture and the Ministry of Water, Irrigation and Energy. Next slide, please. So in order to play roles given to the Ministry of Agriculture and Ministry of Water, Irrigation and Energy, this nutrition workforce development is vital, especially in addressing malnutrition through multi-sector nutrition interventions in those sectors. So agriculture and water technology professionals, particularly the new graduates, are required to attain key nutrition sensitive agriculture and WASH competencies to contribute for improved nutrition. So essential nutrition sensitive agriculture and WASH competencies, however, were just missing in the curricula. So this affected the competencies of graduates. So gross nutrition had been working and supported in integrating those missed competencies for those professionals that contribute for this malnutrition. Next. So the aim of this study was to evaluate the changes in nutrition sensitive agriculture and WASH competencies of graduating agriculture and water technology students after pre-service education interventions, particularly in the middle 3 years intervention period, and determine the effectiveness of the interventions by the project. Next, please. So when I come to the rationale for this evaluation, so there is a need for strengthening the competency of nutrition workforce so that professionals effectively fulfill the roles given by the National Nutrition Program to the sector ministries for Ministry of Agriculture and Ministry of Water, Irrigation and Energy. And we need to have and generate evidence on current competencies of agriculture and water graduates on NSA and WASH, respectively. And we did 2-time studies at baseline and at end-line. So the baseline was used to inform intervention planning and implementation of the pre-service education component of the gross food nutrition, and the end-line findings was used to determine whether the interventions improved the students' competencies after 3 years of intervention period. So this evaluation just helps to evaluate the effectiveness of the interventions implemented by the pre-service education component of the gross food nutrition. Next, please. So the objectives of the pre-post study was first to evaluate the nutrition-sensitive agriculture competencies of agriculture professionals or graduates, and the WASH competencies of water technology graduates, knowledge and skill competencies before and after the gross nutrition project intervention. The second objective was just analyze the competency difference of graduating male and female students before and after the intervention, since the intervention was gender sensitive. And finally, to assess the perception of graduating students towards the learning environment, since the project has been working on the improving the learning environment on WASH and nutrition. Next. So the research evaluation questions derived from the objective. So did the competencies of graduating agriculture and water technology students improve after 3 years? Did male and female students equally competent with those competencies before and after GTN project intervention? And how did students' perceptions of the learning environment change after 3 years of intervention? So in order to get the desired results at end-line, the project has been, especially gross nutrition, has been working through the 4 intervention areas, which were mentioned yesterday in the research presentation. One is a strengthening curriculum. So one of the achievements was integrating the nutrition sensitive agriculture courses in the BSc agriculture curricula and integrating WASH courses into the mid-level, the TVET water technology curricula. So in this process, we have passed different steps, and at the moment, all institutions are teaching with a revised curriculum with NSA and WASH integrated. So in the last couple of years, students were just attending and passing through the revised curricula. The other thing we did was just the staff capacity building, so that we have supported the integration of this curricula. So staff need to be updated with the revised curricula so that they can effectively deliver their newly integrated WASH and NSA courses. So we have provided some technical update, pedagogical skill and skill management, instructional material design, and other capacity building trainings to the academic staff for both cadres. The third one is just program level internal quality audit conducted. So this is just for ensuring quality of education in the institution. So we have supported and worked with the higher education relevance and quality findings from the quality audit using the tools. The other important thing the project did was just system strengthening. In that case, the newly integrated courses have skill components. So students need to practice and demonstrate the skills before leaving the institution. So institution-sensitive agriculture demonstration plots established in agriculture institutions, and 3 new water quality skill development laboratories established in 3 water technology college in 1 college, strengthened so that it will support the learning, and some other materials and SOPs prepared to support the implementation. And there were several technical supports for institutions so that they can effectively implement the curriculum. Next slide, please. So after saying this, we proceed to the assessment. So in the assessment, in both the assessment, we have used some methodology. So we have applied a pre-post study design, and data was collected in June 2017 for the baseline, and in January 2021 for the inline. Actually, the plan was to make the inline in June 2020. As you know, due to the COVID pandemic, the education, the schools were closed, and there were extended periods for the last academic years. That's why we did the post or the inline study on January 2021. So the graduating students involved in 2020, in 2017 and 2021 were different cohorts within the same teaching institution. That is to mean different graduates from the same institution. So in 2017, we did the data collection. So we have been intervening in the 3 years, and we did conduct the inline into 2021. So the study applied a stratified cluster sampling technique to take samples from different institutions and different departments because the number of graduates differ from institution to institution. Next slide, please. So all 8 agriculture and 4 water technology projects supported institutions included at baseline. As you remember from yesterday's presentation, there are 8 agriculture university institutions in the project, and 4 water technology projects supported institutions. But at inline, we have just conducted the study at 7 agriculture and 3 water technology institutions. This was due to just unable to involve 2 institutions in Tigray region due to the conflict. Next, please. So equal sample size were allocated for each study period. And from the total graduates, about 70%, 72% of water and 14% of the agriculture graduates included using the simple random sampling. So structured questionnaire were applied or employed to gather data on sociodemographic statistics and the perceptions and the knowledge assessment, and observation checklists also used for skill assessments for the both cadres for NSA and WASH. Next, please. So objectively structured practical examination or OSPE were used to assess particularly the skill competencies of nutrition sensitive agriculture and WASH for both cadres, and the OSPE for the agriculture consists of 4 stations, which was adopted from the FAO and Food and Nutrition Technical Assistance Project documents based on the National Nutrition Program roles given for the agriculture sector, and the OSPE for water consists of 5 stations that was primarily drawn from the One Wish National Program document based on the National Nutrition Program roles. And the competency pass-fail cutoff points for agriculture was set by experts, while the TVT, especially for water technology careers, the cutoff point was employed using the federal TVT agency pass-fail cutoff points. Next slide, please. So having some of the methodologies, and let me proceed to the key findings for water technology competency assessment. So about 195 students at baseline and 89 at inline students participated in the study. As you can see from the graphs, there is, some of the participants are level 3 and some of the participants are level 4. That is their academic level. There is a difference in staying at school between the two graduates. That's why we included both level 3 and level 4, since both levels pass through the integrated WASH courses. Next slide, please.
Yosef, just a reminder, you have 5 minutes left.
Okay. When I come to the knowledge and skill competency pass rate, as you can see from the graph, about 74% of students at baseline and 83% at inline passed the knowledge assessment, whereas in the skill assessment, only 2% of the students passed at baseline, but 34% of the students passed at inline in the skill competency assessment. Next slide, please. When I come to the knowledge and skill score of students, on average, students scored on average 61% at baseline, whereas 64% at inline, with 3% improvement. And students scored on average 47% at baseline and 65% at inline, with 18% significant improvement in the knowledge score, skill score. Next slide, please. When we see the score difference between male and female students at baseline, the knowledge score difference was 13.5, and the difference reduced to 8.5 at inline. When we come to the skill score difference, the difference between male and female students was 10%, and at inline, this is reduced to 2.3%. Next, please. So when we come to the students' perception of the learning environment for water technology, as you can see from the graph, in most of the indicators, students perceived positively at inline than the baseline, as majority of the students at baseline, about 57%, and at inline, 87%. Inline believed that they were trained by qualified instructors, and 54% of students at baseline and 80% at inline told that their instructors were effective in using student-centered learning methods. Next slide, please. When I come to just some of the discussion points, as you have seen from the results from the knowledge and skill competency assessment for water technology careers, the skill competency assessment, the skill competency of students improved significantly with 32% different. We believe this could be associated with the integration of the skill competencies in the revised curriculum between the two studies, in addition to the establishment of the functional skill lab, availability of learning resources, and improved exposure of students in the skill lab. As you have seen in the perception part, more students perceive positively at inline. So more proportion of male students passed also in the knowledge competency assessment at baseline than the female students. This difference narrowed significantly to 12% at inline. So as you have seen, no female student passed the skill competency assessment at baseline, but 27% of them passed at inline. This could be attributed to the gender sensitive interventions in the project and in the institutions as well. Magda, can you allow me invite Amara to present the findings for NSA?
If it's not too long, Amara can just jump in and so we
okay. Okay, I'll be back if there are issues that will be raised for the WASH part. Amara, are you there? Can you proceed?
No? Are you hearing me? Thank you, Yosef and Magda. I'm Amara from Jhpiego, Education and Training Advisor for Agriculture. And I will be presenting the results for the agriculture sector. And as you see, the methods are similar to the WASH section. And as you see, students participating in our studies, 337 as a baseline and 339 as the inline take part for our study. Next slide, please. And when you see the knowledge and skill competence, our main objective here was to measure the knowledge and skill competence of our students. And as you see, the knowledge in the first study, in our first study in 2017, 51% students passed the knowledge and 73% students at the end line. And when you come to the skill competency, about 60% and 86% respectively passed the skill competence for the inline study. Next slide, please. Students scored on average, this one is the score. The score 45% at the baseline and 51% as inline with significant improvement of 6%. As you see, the knowledge score at the baseline was 45 and 51 at the end line. And when you come to the skill difference, it was 47 and 60% at the end line. Next slide, please. This is the score difference between male and female. When you see the variation at the baseline, it was wide gap 0. The wide gap about 7%, and it was 3% for knowledge. And when you come to the skill, it was the variation was 7, and it became finally 2%. That is narrowed or minimized as the end line, showing significant improvement in the variation. Next slide, please. This is students' perception on the learning environment. When you transpose this, assume the transposition of this figure to the left, and the questions in the x-axis are designed in a way to capture students' awareness on the learning environment. And this was in 3 sections: the academic environment, the practical teaching, and the curriculum. That you see, as you see, when you see regarding the curriculum, about 49% of students as the inline perceived their curricula has sufficient nutrient-related content compared to 21% at the baseline. That showed a significant improvement as well. And 24% of students at the baseline and 48% at the inline thought that the learning materials are available and adequate, and they were up to date as well. Next slide, please. Generally, the summary of our findings shows that 60% of students pass the skill competency assessment at the baseline as compared to the finally achieved students 86% with a significant improvement with p-value, as you see. This could be related with the integration of this nutrition sensitive agriculture competencies in the revised curricula between our 2 studies. In addition, the faculty capacity building on NSA, availability of standard learning resources, student skill learning in NSA, demographics are more students perceived it positively at the end line, which is 36% as compared to the baseline, which was 26%. More proportion of male students with 28% difference passed the knowledge assessment as a baseline than female students, which was 10%. And more proportion of male students passed the knowledge assessment as a baseline than female students. However, this difference narrows significantly to 9% at the end line. Generally, in all aspects, the result shows positive improvement in what have been measured. Next slide, please. Okay. To conclude, students' knowledge and school competency showed improvement after project intervention, as indicated in the pre-post study, and integration of NSA and WASH competence in the curricula with development of standard learning materials contributed for improved competence in both knowledge and skill of the graduating class of students. Next, please. The faculty or the institutions in NSA and WASH technical areas and pedagogic skill training on effective teaching assessment skill lab manner contributed for students' competence improvement. Next, please. Availability of water skill labs and nutrition sensitive demonstration plots and students' exposure to practice on NSA and WASH skill have improved students' skill after our intervention. Next, please. These are the ideas forwarded for or recommendations. Pre-service education intervention should follow a comprehensive approach to bring about the desired outcome in graduating students of every institution. Next, please. Agriculture and water curricula need to have nutrition sensitive agriculture and WASH competence to so that graduating class students can contribute to improved nutrition of mother and children. Next, please. Project intervention should address gender issues so that both can have the required competence and contribution in the national nutrition program implementation. Next, please. A skill lab should be available, equipped with the necessary material, and should be accessible to students with adequate number of skill lab assessments so that students are exposed to the basic skills, especially for practical skills. Management and faculty capacity should be strengthened so that gender-responsive, student-centered teaching and assessment methods are applied. This improves the quality of education in classroom, skill lab, laboratories, and the practical sites. Finally, similar studies need to be conducted because this is a one-time study, though the time frame was at 2 points in time. Additional studies are very mandatory to come up with conclusive recommendations. By this, I will end my presentation. Thank you very much.
Thank you both, Yosef and Amara, for the great and clear presentations. I think you have few questions on the chat box. Yosef has already started responding to some, but during the presentation, it will be good to look at some of the questions on the chat and respond as much as possible. And now we're going to quickly move to our second presentation. Dr. Abdulhalik, you have 20 minutes.
Okay, thank you, Rahel. Can you hear me?
Yes.
Okay. Yeah, I'll try to be brief so that we can catch up with the time allotted in the schedule. So, and I'll be presenting, well, there's a little bit modification on the topic from what is stated in the agenda, but the content is similar. So next slide, please. So this is the work that we have done at GTN in order to assess the, yes, if you remember from our yesterday session, we were talking about innovative approach in terms of rolling out different SBCC messages, one of which was using virtual facilitators on top of other communication strategies to transmit standard messages for the beneficiaries. So most of the SBCC strategies, including the electronic and print medias and the enhanced community conversations, which were implemented by Grow Through Nutrition were focused to address different nutrition, health, and agriculture interventions, which were thought to be locally contextualized and will result in ultimately the intended objectives. So the introduction of virtual facilitators in this approach was with the aim of standardizing all those messagings so that all the beneficiaries will get the appropriate message at the different tailored sign points so that they can improve their behaviors in terms of nutrition practice, wash practice, and different household decision-making practices. So the virtual facilitator, to give you a highlight of that, was it was a recorded material which is to be played by any audio player or on a cell phone, so that the facilitators will, whenever they approach and whenever they have sessions with the beneficiaries, they will play the recordings, which are all similar for all beneficiaries, so that it includes the different messagings, different interactions with the facilitators. So the intention was those standard messagings on top of other SBCC strategies, which are discussions among the ACC groups, and as well take-home messages and print and electronic materials will enhance the positive behavior change practices. Next slide, please. So with this intention, we wanted to assess what would be the added value of using that innovative approach in terms of improving infant and young child feeding practice, and as well to some extent also household decision-making practices. So this study was conducted in 3 waradas and the design of a quasi-experimental study. We had control groups, both intervention and control groups, and at the same time a baseline and follow-up data collection. So it's technically we looked at the difference between the groups and also across the time points to identify the added value of the specific SBCC strategy. So possibly I will share the link for, we have just published this study. I'll be sharing the link later on after my presentation so that you'll get the details of the intervention package. So next slide, please. Yeah, so we have targeted around 414 households evenly distributed across the intervention and control groups. So we have reached these households prior to rolling out intervention, and also after 10 months of intervention, then we had collected the data. Next slide, please. So in terms of outcome, we have assessed minimum dietary diversity for children, minimum meal frequency, minimum acceptable diet, wash practices, maternal diet diversity. So we have looked at these outcomes to look at how they were affected by the intervention. Next slide, please. So in general, most of the indicators that we have assessed, or most of the outcomes we have assessed, we have seen improvements from baseline to inline in both control and intervention groups, irrespective of the additional value of virtual facilitators. There are slight improvements from baseline to inline across the groups. But we later on I'll be presenting what added value the intervention had, because we had seen a much more improvement in the groups with inclusion of virtual facilitator as a strategy for most of the indicators that we have looked at. But in general, most of the indicators that we have seen here, like initiation of breastfeeding, taking iron folic acid supplementation, minimum meal frequency and minimum acceptable diets improved from baseline to inline. In some of the cases, the differences might not be statistically significant, but given that the quantity of the change, the percentage change, given that they're higher, they could have a meaningful practical importance. Next, please. So here, the graphs show in terms of consumption of different food groups across the two time points in baseline and inline with control and intervention groups. The first graph on the left is showing the consumption of the different food groups across during baseline between the two groups, and the graph on the right side is at the end line. So as we see, there are improvements, much improvements in the intervention group, but also we can see improvements in the control group as well from if we compare the inline and the baseline. So improvements, especially in vitamin A, fruits and vegetables, legume and nuts, to some extent dairy products were also found to be significant. Next, please. Well, this is to show in terms of maternal diet diversity, as I said, in terms of consumption of the first one for lactating mothers, frequency of consumption of food before the intervention and after has also shown improvement, being a significant one at the end line, but also we have seen a modest improvement of maternal diet diversity, even though it's not statistically significant. Next, please. This particularly shows the findings from WASH practices. So in terms of hand washing at critical times, we have seen very significant improvements in the intervention group at the end line in terms of hand washing after toilet, after eating, before feeding children, which we think are very important positive practices and would have a relation with child nutritional status and as well other health and preventing other health problems, both among household members and as well children. And also construction of wash facilities at the household level, and also separating the living places of households and livestock. Any households at the households was also found to be significant. So this actually showed improvement both in control and intervention groups. Next slide, please. Okay, next, please. This one is also included in the later table. Next one. Okay, yeah, this is no, the earlier. Sure. So table, we wanted to present the so in order to identify added value of the virtual facilitators, the introduction of virtual facilitator. So we have used difference in difference analysis, so that we estimated the interaction between the group variable, which is the control and intervention, and as well the time variable from baseline to inline. Of course, we might expect different reasons for the change in behavior, but actually from improvement that we have seen, the virtual facilitator in the intervention group has resulted in significant role in positively impacting all these indicators that we have listed. To mention some, the ones that the p-values are bold, where the changes which were found to be statistically significant. But as you can see in the second column, where we have presented the coefficients in terms of percentage, this is for ease of understanding. So that shows the percent changes that are that can be attributed to the introduction of virtual facilitators as a mode of SBCC strategy. So we have seen a very high increment, like around 20% in diet diversity, and also around 18% in minimum acceptable diet. And also a range of large to moderate improvements across infant and child feeding practices, wash practices, and household decision-making practices, and as well were positively affected by the introduction of virtual facilitators on top of the other SBCC strategies. So this means that multiple approach of using multiple strategies in rolling out SBCC interventions would result in a much improved outcome. Next slide, please. So intervention and control groups have positively improved in the times that we have measured the data, and improvements in child nutrition, diet diversity, and as well other infant and young child feeding practices were exhibited in this research. Positive changes in the consumption of special legumes, nuts, dairy, eggs, and vitamin-rich fruits and vegetables were also among the findings in this research. Next slide, please. So changes that we can attribute to the use of virtual facilitators and found to be statistically significant include IFA intake for more than 3 months or more, and cases like construction of wash facilities at household, hand washing at critical times, joint decision making, having a separate place for livestock were included. But equally important there are significant improvements in minimum diet diversity, minimum acceptable diet, and diversity of the woman. Even though they are not statistically significant, we have seen that the changes are very large, which do practical implications for program activities. Next, please. So from the studies, we have learned that we need to consider the magnitude along this, we don't need to focus only the statistical significance only as well, and also rolling out multiple strategies for SBCC messaging would benefit a range of nutrition and health indicators and WASH indicators. So probably tailoring our SBCC interventions towards to the outcomes which can most effectively addressed by our interventions would be important. And also strengthen the use of multiple SBCC strategies, and of course, whenever we are rolling out in case of any intervention, SBCC interventions also need a very good monitoring strategy so that we can monitor the compliance, standardization of the message, whether they are properly rolled out to the intended standards, so that we can achieve the ultimate goal. Next slide, please. Yeah, of course, this can be complemented, these findings can be complemented as well with, looking at those behaviors which are positively changed and looking at whether they are sustained as well, and exploring the various factors which could help in sustaining those behaviors, so that those positive practices can be staying there for the long term. With that, I'll conclude my presentation. Thank you. I hope I have used my time efficiently.
Thank you, Abdul. Actually, you finished before your time is up. Now we are going to quickly move to the third presentation from Yeshimebet. Over to you.
Okay, thank you. Can I start? Hello?
Yes, please go ahead.
Okay, thank you for giving this chance. And the title on our research is The Effect of Nutrition Education on Dietary Diversity, Nutritional Knowledge, and Nutrition Status of Pregnant Women. Next slide. This is presentation outline. Next. So as an introduction, it's known that adequate dietary intake, or including the dietary diversity, is a means to break the intergenerational effect of malnutrition, mainly the chronic malnutrition for child growth. It's also important to end hunger and fight against poverty as a component of SDGs. So this should be continued within the first 1,000 days of life, since it is the best opportunity for reducing undernutrition and its adverse effect. So as a rationale in our setup, in our study setup, maternal undernutrition, low dietary diversity, and knowledge gap on pregnancy-specific nutrition was the main problem. And this problem is not only in our country, and it's also a common problem in the globe, mainly in developing country. Next. So globally, this nutritional deficiency is common. Mainly it affects women in developing country, and which results in increase in morbidity and mortality and disease burden. And also undernutrition, which may result in decrease in gestational weight gain, and this ends up with low birth weight, and it's common in our country, accounts 13% from EDHS. So at the end, this low birth weight and chronic undernutrition on the mother can end up with chronic metabolic disorder as later in life. So another nutritional problem in our country is micronutrient deficiency as a hidden hunger. So 80% of pregnant women shouldn't take the recommended nutrient intake of iron, and as well as 25% of pregnant women shouldn't take vitamin A. So this implies that their cognitive development and immune competency becomes decreased, not only for the woman, for the fetus, as well as for the coming newborn can be affected. Next. So having this, there are a number of efforts done in our country, including adoption of SDG. We do have an NNP2, which focus on maternal and child nutrition, and other nutrition strategies, including nutrition policies. Despite these policies and program, we do have a number of nutritional problems, mainly the macro and the micronutrient deficiency. From this, 22% of reproductive age women were undernourished, and nearly 24% having micronutrient deficiency or anemia. And also near to 2/3 of the pregnant women having antenatal nutrition counseling, but the nutrition counseling focus on nutrition specific intervention, mainly on iron folic acid supplementation. So there was a limited study in the study area, and there are gaps on identifying how far their behavior can be changed. and how far this nutrition education is effective to change their nutritional knowledge, dietary diversity, and nutritional status was not measured. And since it is important for better birth outcome and best start in life, so it needs to be measured, and that is why we plan to measure these activities and intervention. Next. So our aim to measure is, in order to measure the effect of this nutrition education using the standard model, the health belief model, on dietary diversity, nutritional knowledge, on pregnancy-specific nutritional knowledge and nutritional status of pregnant women. So we do have some specific objective that was measured. Next. So regarding the methodology, our study area was the rural communities in Dessie city as northeastern part of Ethiopia. And this study design was cluster randomized controlled trial supplemented with qualitative method. And this qualitative method was used to identify the contextualized factors for inadequate intake of nutrient or nutritious food in the community. Our target population or study population were pregnant women in the first and second trimester were included in the study, and the total sample size was 132 at the beginning, and at the end for analysis, 113 were included for analysis. Next. So data collection procedure, we do have the open data kit mobile app to collect the data, particularly the quantitative part, and qualitative part was collected with semi-structured questionnaire, anthropometric measurement of MWAC, and qualitative focus group discussion among pregnant women, which were not included in the qualitative part, and in-depth interview of health extension workers and coordinator of health extension workers were included. Concerning the data quality, pre-testing was done in non-selected areas, and a reliability test was done, and having Chrome batch alpha less than 0.7 was excluded from the tools, and training of data collectors and supervisors were given ahead. Next. So this is the cons on the diagram, the flow on how this cluster randomization control was done. Initially, we do have 132 study participants. At the beginning, 5 were excluded due to their pregnancy duration, and 127 were included in the baseline assessment before intervention, then of which 64 were intervention group and 63 were from control group. Through the process, we do have 4 lost to follow up in the intervention group due to abortion and not attending all sessions, and 10 lost to follow up from the control group due to different reasons. So finally, we do have 60 from the intervention group and 53 from the control group. Next. Intervention, what we provide were, we provide group nutrition education using the health belief model every 2 weeks for 3 months. And that education was lasted 30 to 45 minutes. And we have used different teaching methods like lecturing, interactive group discussion, motivational interviewing to share their experience. And I had this best experience for others, role play and demonstration on how to prepare diverse diet and how to prepare high quality diets. Next. So data analysis, we use paired and independent t-test, and also the general linear model, ANOVA was used, and qualitative data were analyzed with thematic content analysis, and ethical clearance were obtained from Wollo University. Next. So this is the descriptive finding. At the beginning of the study, all variables, including the sociodemographic and obstetric variable, didn't have any significant difference at baseline. but we find some significant difference in some variables. So at the baseline, there is no significant difference. Next. So this is another knowledge before intervention and after intervention. There is a significant difference on knowledge among the intervention groups, shift from 34% to 93% after intervention, and also there is a slight improvement in the non-control groups, but it was not significant before intervention, and also it was not significant difference among control groups than the intervention group. Next. So there is a change in nutrition status of the woman, pregnant woman, by 21.4% among the intervention groups, as compared with only 2% improvement with the control groups. Next. So here is the analytical parts of our finding. There is a significant difference on nutritional status, dietary diversity, nutritional knowledge score, and constructs of health belief models, mainly the perceived susceptibility, perceived barrier, and cue to action. And also there is a significant change in WASH index. So this change can be due to the nutritionist education, and it implies that there is the occurrence of behavioral change. Mainly the MUAC can be changed within 1.3 centimeter after intervention on the intervention group. The same is true for dietary diversity score on the woman. There is a change in 0.9. Knowledge score also increased. And the perceived susceptibility, how far they are perceived, is that the severity, the severe complication of inadequate intake was assured with a change in these variables. And also perceived barrier becomes decreased. Since women are perceived that there are a number of barriers to consume diverse diet and maintain their nutrition status, including the cost of fruits, vegetables, and food items, and the time for preparation was their problems. But after education, these barriers can be improved, and the value for barriers becomes a decrease in the intervention groups. The cue to action means the motivational factors to consume diverse diet and maintain their nutritional status, and also to increase their knowledge on pregnancy-specific nutritional status becomes increased, since education by itself also will motivate them, and their advice from family and friends were improved, their nutrition status and knowledge. The WASH index, after making within this principal component analysis, the WASH index can be changed within. At the beginning, there was a significant difference. So the value on the intervention groups were higher due to the nearest, this community have education session in both cases, but the possible justification in this case was not justifiable. But at the end, this difference may be higher as compared with the beginning. Next. So the strength of this study is using the health belief model and triangulating with qualitative method is best. And the limitation was this is a short-term intervention within 3 months, and it may not measure the sustainability of their behavior change after post-intervention assessment. Next. In the summary, we conclude that nutrition education using the health belief model is having significant effect on improving pregnancy-specific nutritional knowledge, dietary diversity, and nutritional status, and WASH index. And there is also a behavioral, this nutrition education can create a behavior change mainly on perceived severity, perceived barrier, and cue to action for prevention of malnutrition. Next. On recommendation, this nutrition education can be integrated as early as in all antenatal visit. Mainly, it should be started early in pregnancy, and it should be continued within the first 1,000 days, since to prevent the chronic malnutrition. So improving knowledge of women in pregnancy-specific nutrition and follow-up on data adherence to dietary diversity practice and iron folic acid supplementation should be strengthened at the community level. Mainly, it's better to use the health building model to change their behavior and for adherence. Next. This is our acknowledgement. Next. We would like to acknowledge the Tufts University, Wollo University, and all study participants and all staff members of Tufts and study participants and data collectors and supervisors. Next. So this is sample of references. Finally, we'd like to thank you for your attention and giving this chance. And regarding the discussion part, this finding or similar with other studies and the possible explanation where this nutrition education using the health building model can change the knowledge of the woman, and having adequate knowledge can encourage them to practice good dietary practices. So thank you.
Okay, thank you, Yeshimebet, for the great presentation and very clear, and also for finishing before your time is up. Okay, now we are going to move to the next session, which is a question and answer session. We'll have 30 minutes for that. I see that most of the questions have already been responded on the chat. So Alamaya, if there are any questions from the chat that are not responded, please forward some of those questions to the presenters. And after we finish with that, we will also give a chance for participants to raise their hands and mute their microphone and then ask a question if they have any additional ones. Thank you.
Good morning, everyone. This is Alamayo. Thank you very much, Rahel. I want to thank the four presenters, Josie, Amara, Abdul, and Yeshimebet. Yes, Yeshimebet, for the nice and timely presentation. Saying this, there are questions forwarded in chat box. So even though it is addressed, we have 30 minutes. I invite Yosef, because most of the questions are from Yosef for Yosef. So even though it is answered, to share for the team, I invite Yosef to address the questions that's shared in the chat box. Thank you. Yosef, may I ask you to address the questions one by one?
Okay, thank you, Alex. One is the effect of the school closure time on COVID-19 to the study results. As you know, school was closed almost for a year in higher learning institutions due to the COVID-19 pandemic. So we believe this affected the competency results of students, particularly the skill competencies. These students were at home, but they were reading the materials while they were at home. There were some support from their institutions remotely, but they were away from the practice, especially the skill practice at the learning institutions and at the practicum sites. So this affected the skill competencies of students. So this reduced the skill competencies results at in-line compared to the expected competency results, since we know their competency assessment results were significantly improved before COVID-19, as the national competency assessment from the institutions show the skill competency assessment result was like more than 80% for the WASH competency assessment. That interrupted and affected the project results due to this COVID-19. The other one is the question raised by Catherine, why it's still low. Students, I mean, about 34% still passed the skill competency assessment. Actually, it was 2.2% at baseline, but this is significantly improved at inline, but the expected number or figure is not this one. This is one is a factor due to the COVID-19, and there are also other factors related to engagement of students to the practical learning environment at the institution as well as at practicum sites. We learned that the students' exposure to the practicum sites were very limited and very low. This can be related similarly with the COVID-19 closure time. And in addition, there is a lack of system in the sector to link students to practicum sites. So this is our recommendation to improve the competency of students, especially in the WASH area. The other question raised by you is competency result is very significant for skill, but small. The difference is small for knowledge assessment. This is due to several factors. One is the big gap at the beginning, at the baseline, was in the competency of the skills, not the knowledge. So they have some knowledge in the knowledge competency area. So the project contributed to improve some rather than in the skill assessment. In the skill assessment, there were different gaps. There were different competency gaps in the curriculum. So we tried to address those competencies. So we try to support institutions establish the practical learning environment, including the laboratories. So the skill gap a little bit improved to that level. That was the difference. Otherwise, the interventions were similar, and every intervention, I mean, skill starts from the knowledge. If I missed some pointers, Enris and Amara will help me address the questions. Thank you, Alex.
Yeah, Josie, I can, indicate, some of the questions, regarding to Megan. Her question was, why, the passing rate is very low, which is 30%, extremely very low. What is, the reason behind? That's one of the questions. From the MEBT, do you observe any competency difference among institutions and programs for both carries? That's the question. Also from Dan, it's already answered. And also from MEBT, only 49% of the students for agriculture carries are perceived, the curricula has sufficient nutrition content. This is after the integrated nutrition sensitive agriculture competency in the agricultural curricula. What tells us this in the assessment finding? There are more questions. So these are some of the questions which is forwarded to you.
Okay. Andres may help in responding to MEBT's questions related to the nutrition sensitive agriculture. Yes, please.
Yes, Isamal.
Yeah.
Isamal, Andres.
I think it's
Please
Amara.
Amara ነኝ መቀጠል እችላለሁ ዮሴፍ?
Yes, please proceed.
አማራ ነኝ አለማየሁ መቀጠል እችላለሁ?
Yes, please proceed.
I am Amara. Okay, thank you, Yosef. Some of the questions have been already answered by Yosef, and the left are 2 points raised by Yosef, Dan, And for the first questions, competency difference, have you observed competency difference among institutions? That was one of the questions for Mebet. And our response, actually, we respond in the chat box. We didn't see comparisons among institutions. The intention of the study was not that, because comparing institutions may have its own implication. Rather, the objective of our study was to see the variation in knowledge and skill competency among students and by sex as well. The next question was raised by Alamayo. Why there is the knowledge gap is less as compared to the skill gap when compared to the baseline and the endline. This is because, as you know, most institutions deliver education in knowledge-focused base rather than skill-focused base. This may be attributed to the fact that most institutions in Ethiopia are new, and they don't have well-furnished skill labs and practical demonstration sites. And because of that, students lack access to acquire the required skill in practical teaching. That was the reason. And the second question was raised by Dan. Why do you think that the COVID-19 pandemic interruption of these higher learning institutions impacted your results? It says, because due to COVID pandemic, institutions have been closed, as you know, and because of that, there was a shift in the academic calendar. Those who have to graduate in 2020 shifted to 2021. And that was also had a significant impact on the timing. They didn't have sufficient time to learn in practical, especially for practical demonstrations or practical learning. Because of that, the students' competence in practice it was highly impacted. I think the next question was Mebet's question. It was at the end, still 49% of students perceive that their curriculum have sufficient NSA integration. What implication does it have? It says the implication is that further intervention, it requires further intervention because this NSA integration is a new approach, and still all students at higher learning institutions do not have even the information, sufficient information. This tells us further intervention, and it requires further effort. Thank you very much.
Amar, still there are questions, recommendations needed from you. What efforts and interventions on nutrition sensitive agriculture is important in higher learning institutions? That's one of the recommendations or the response which is needed from you.
I see. This NSA have been integrated in the curriculum more recently, and because of this, even all instructors do not have sufficient information regarding this NSA integration, and we need to work on it for the future. It requires serious attention and follow-up for the integration and full implementation of this NSA courses in the curricula of all higher learning institutions, especially for agriculture institutions.
Thank you very much, Amara. There is a question for Yeshimebet. Is there, is 3 months intervention for nutrition education is sufficient to bring, the desired knowledge on dietary diversity at the community level? That's one of the questions.
Thank you. The 3 months education is not sufficient. I write it as a limitation of this study and recommended for further research to have more time in order to have educate knowledge and behavior change regarding nutritional practices and the nutrition status. Yes.
Thank you very much. Yeah, thank you very much, Yeshimebet. Audience, you can unmute your mic, and by raising your hand, you can forward your questions for the presenters.
I think there is one question from the chat for Abdul. He has tried to respond through the chat, but it might be good for Abdul to explain it more live. Abdul, do you want to discuss on the question on VF?
Sure, can I go ahead?
Sure.
Yeah, okay. So thank you very much. I think the first question was from Warku. Well, he asked why the VF was not effective in the IYCF, the nutrition indicators, apart from the wash and decision making. But I think when I present the results, I showed that it was just not statistically significant, but it does not mean that the effects were not important. If we refer to the results, even the effects were very much larger for those indicators than the wash and decision-making indicators. So still the VF do have a positive impact on improving minimum acceptable diet, meal frequency, and diet diversity as well. So understanding the amount of change, I mean, given that the amount of change is higher, so it would be important now to focus on the statistical part also, so that we should interpret it in a way how practically important that is for the program as well. So I believe the effect is also profound in those indicators, apart from the wash and the decision making. Regarding the role of the health extension workers, you are completely right. So the nature of the study, since it's not a randomized one, and we did not really rule out whether some activities in the community, like the effects of the health extension workers, could not be, ruled out from their role in improving the behavior of the community members. But what specifically we intend to identify through this research is, in addition to all the existing interventions, giving that other strategies, and also the other demographic variables, what additional role would using this SBCCBF modalities would have. So if you have seen the percentage changes, those are very limited. So the remaining amount of change in improvement would be explained by so many other factors, including the routine health services that the community are receiving, given that it would be varying across intervention in control groups. So that can be explained by that one. I'm not sure if there is another question for me. Is that if feasible to implement at scale in addition to ECC? I thought it seems human resource. Well, okay, so the question from Annalee, well, it's a very important question. So probably as a recommendation, after we conducted that study, as a recommendation, one of the things that we need to test further is, well, in terms of resulting positively changing the behaviors, we have seen that it does have a good effect, but there could remain different issues to scale this, to roll out this at scale. We need to look at the cost effectiveness, and as well, we could also test different strategies. At this point, we have seen the messaging through VF being rolled out by facilitators. So in terms of, you know, in a scenarios where our beneficiaries do have access to mobile phones, what if we can roll out the messagings so that we can deliver the messagings and upload the messagings with their tool, so that we can still increase, apart from standardized messaging, we can still increase the intensity of exposure to those messages, so that that would still even enhance the benefit of the messaging. So we could think of different strategies to go around the hurdles in terms of resource, or specifically human resource demandingness of the implementation. So I think that would be one strategy, but to roll it at scale, we need to, of course, test how cost effective that is, in line with also a different approach of rolling out the messaging from virtual facilitators. That's my reflection for a question from Anile. Thank you.
Thank you very much.
Yeah,
Thank you very much, Abdul Halik. Is there any question from the audience? I have no, it's not visible from my desk, from my computer, that, who is, raising his hand or her hand. So please take, your time by speaking. You want to speak, you want to raise in your question. Is there additional questions from the audience? Let us use, our time. If not, we'll close up.
Andres, unmute and continue. Alex is not your hand.
Alex, hello, are you?
Yes.
Can I add
Please
some
yes,
points?
Andres.
Yeah.
Yes.
So Joseph and Amara have tried to, try to respond to some of the questions raised, but I just wanted to add on, especially on the low skill pass rate of students. Skill competency development, as we all know, starts in a classroom, and it continues in a skills lab with demonstration and guided practice of those skills, and also it has to be again it should continue in the practical side. So there are different skill learning environment, and we had to work on these different skill learning environments, especially on the skills lab with regard to the WASH skills. We established 3 new WASH skill laboratories in 3 of the Water Polytechnic colleges, and we had to equip those skill labs, to make them conducive for those WASH skills learning for students. And in addition to that, even the skill, the skill assistants, skill lab assistants, were not familiar with some of the WASH skills which were introduced into the curriculum, and we had to, to give, this skills training for the skill lab assistants. We had to provide them with skill lab management training, so that they can teach those WASH skills to the students effectively. So all these preparations have taken some time without students getting the required skills that they need to attain according to the revised curriculum. And maybe that could be one of the reasons for low skill score by these students. And the other thing with regard to the questions raised by Mert, the perception was only 49% for NSA content integration, because some of the students in some of the departments were not were not given this NSA course for different reasons. Some of the universities, some of the agriculture departments were using the old curriculum for reasons we don't know. There was revised curriculum, but some departments in some of the colleges were using the old curricula without the NSA course, and some of those students which were involved in this study were not aware of this NSA course integration because they were not given that course, and that could be the reason why their perception was lower, as you indicated. And with regard to competency difference among different institutions, we were not interested to assess the competency difference among different institutions. We are not interested on that, and we just tried to see the overall competency improvement over different institutions, across different institutions, whether there is competency difference in terms of knowledge, in terms of skill by this agriculture and also WASH students. So we didn't calculate and indicated that in our study. That's what I would like to say. Thank you.
Thank you very much, Idris. Guys, do you have additional question or any additional response?
Can I add one quick point, Alamai?
Yes.
This is Abdul Halik. Okay, there was, the issue of statistical significance, from both questions. Well, especially for the indicators around IYCF practices, we did not rely much on the statistical significance because we know there were changes in the sample characteristics from our study, from baseline to inlines. Some children were aging out, so some indicators were not, appropriate to assess on them. So baseline characteristics in terms of some demographic variable, or in general, sample characteristic was a little variant to affect the statistical tastes. So the statistical significance do have more to do with the sample size. So that would be one reason that we were much interested in the percentage change, even though the tests were not statistical significant.
Thank you, Abdul Halik. I think it's all.
Lul has raised his hand.
Okay. Go ahead, Lul.
Okay. Thank you, Alex, for giving me the chance. And I would also like to appreciate all the presenters for their very informative presentations. Not a question, but maybe just a remark or what I felt should be highlighted from the first presentation on competency assessment of NSA and WASH, impact of integrated curricula on NSA and WASH. Yeah, my concern is I also share the low skill competence for both WASH and NSA, and also acknowledge the improvement seen at the end line. But what I have noted is the 2% skill, for example, competence registered at the baseline for WASH. It tells us that those who are currently in the market, the cadres currently working under the WASH sectors, are of very low competence when it comes to the nutrition related skill, and that also works to some extent for the knowledge component. So as actors working closely with the sector, both in pre-service as well in the in-service area, I think we should note that, and that would be an area for us as well, all other multi-sectorally engaged partners to work on. It tells us that those, even before the coming of GTN or other related support, were of very low competence when it comes to the nutrition workforce in WASH and somehow also in the agriculture sector. Similarly, after 3 years, for the different reasons that researchers were informing us now, we are still having a 30% skill pass rate, for example, for the WASH-related skill competence. That still tells us even the current graduates need to be highly followed up when it comes to strengthening their nutrition-oriented knowledge and skill competence. So for me, I know the assessment and direct objectives of these studies were on evaluating effectiveness of the pre-service education interventions, but it tells us a lot about what is going on when it comes to the service provision that we expect to bring about changes in nutrition outcomes in the end. So these are, I think, should be captured some way as programmatic lessons and need to be clearly communicated with the sectors we work with. Maybe it might also be time to recommend for continued professional education. I know we have this kind of mechanism in the health sector where cadres experts continue to develop their expertise in different areas where such low competence is detected. So this might be something that we can recommend for both sectors and the education sector, higher education sector too, so that we can also go beyond strengthening pre-service education and address the current very limited capacity, which we all share as a concern, detected particularly when it comes to skill competence among these key cadres. So that's one thing. And the other concern I have that also goes a bit beyond the direct attention of these studies, but given the current new roadmap and the differentiation strategy to be followed by universities, we should advocate more and be sure how far the new integrated curriculum would be taken forward by the government. It is really great. It was really great to see that these courses were endorsed not only by grocery nutrition supported universities, but throughout agricultural universities as well as WASH TVTs in the country, which is a great success. But given we have somehow a slightly changed roadmap, as well as what they call as differentiation or kind of specialization to be followed by the universities, how far this attention for nutrition will be taken seriously, need closer follow-up, and that can also go as a recommendation for the higher education. That's more with the PSC-related studies I have. And for the cluster randomized trials, since the study was also done at the university level, and we, from the nice presentation we had, maybe there might be issues that were not raised here, but in this kind of trials, we should really take care on how we pick our case and how ethical our approach was. I know that was addressed, but especially we know this key nutrition message, they should go to all mothers who attend antenatal care, and all mothers should be referred to antenatal care too, whether they are in the control or in the intervention group. So this one facility-based intervention, they should all share. And similarly on the community, we have this kind of community activities like the Pregnant Mothers Conference, and we should make sure all were referred to those kind of service. It might be there in the detail, but as an academia will work more on this kind of trials, these kind of issues, particularly referring our source population or study population to those interventions, benefits of which is clearly known, should be well addressed. So I would like to emphasize on the ethical component of that study and to describe it whenever this kind of event is there for dissemination. And finally, I fully agree with Abdul Halik's recommendation from both general recommendation. Applying both approaches using VF and non-VF, we have seen notable changes in improving maternal and infant young child feeding nutrition practices. From both approaches, we have seen notable changes, progress. So it's about taking which approach to take forward, taking all the inputs required to conduct both sessions. So it's more of a practical choice that takes us forward. Otherwise, we have seen both approaches can be applied. When it comes to practicality, for example, one point I would like to highlight is, you remember yesterday the presentation from our one of our local implementing partners. One major challenge they are facing, especially when it comes to implementing in SN and PR, is the difference in language between the different zones we have there. Usually this VF audio recorded message being prepared at higher, somehow central, at least at regional level, they tend to follow the working language of the region, as in the case of SN and PR, for example, Amharic. So the VF as a standard tool, it applies this language in all the zones, while the non-VF or the trained facilitators, they use the language and somehow modify the session using the standard training materials and provide or facilitate the sessions. So the VF might not be that adaptable when it goes down to the community level. In fact, that was not focused and studied under this specific study. And there are also lots of factors, as Dr. Abdul Halik mentioned. But just from our experience and what we had yesterday, we can see this kind of difference, which make us to recommend, based on practicality, not only statistical significance, when it comes to choose between the VF facilitated and non-VF approach. So from the three presentations, these are the general remarks I have. I don't think they need a response. Thanks a lot for giving me the chance, Alex. Thank you.
Thank you, Lul. It's a big indication, especially a big assignment. There is big assignment on the government and other stakeholders, especially on how to improve the knowledge of the countries on nutrition sensitive agriculture. So that's a big assignment for all of us. And saying this, I think it's time.
Yes. Thank you, Alemayo, for facilitating the Q&A session, and all the speakers for the great presentation, as well as addressing some of the questions from the participants, and also Idris and Luhud for responding to some of the questions and giving your general remarks on some of the presentations. Thank you so much. Now it's time for us to break for coffee. So why not we take a 15 minutes coffee break? So we should be back here by 10 after 11.